in the morning, presented by First Commonwealth Bank here on WCCS, AM 1160, FM 101.1. Let's say hello today to Jamie Chichy, who is with the Human Motion Institute, but a very specialized department of the Human Institute. You are a doctor of physical therapy.
Yes, correct. Good morning.
Good morning. It's good to have you with us here today. I had no idea that the Balance and Concussion Center actually existed.
Yes.
Within the HMI.
Yes, we've been a part of HMI for approximately the last 2 years. We're a part of Indiana Total Therapy, and we focus our care on patients with concussions, balance and instability, patients with high fall risk or in need of balance training with a walker or other assistive device, and also patients with dizziness and vertigo.
Okay, let's get that microphone just a little closer to you. I'll push it a little bit, like so.
Okay.
There we go. We'll be able to hear you a little bit better. You know, when we hear the word concussion, we naturally think, okay, school sports, people getting hurt playing school sports. It's much broader than that, isn't it?
It is. You know, we see work-related injuries, we see motor vehicle accidents, falls.
Yeah.
Which, again, brings us back to, the balance part of the Balance and Concussion Center.
Mm-hmm. The elderly then come into the equation very much.
Very much so, yes.
Yeah. Elderly people have balance issues anyway, and it can be from any number of causes, neuropathies, just any sort of medical issue that has built up over the years.
Great, exactly. Total joints, degenerative joints. We see a broad spectrum, like you had said, individuals with neuropathy, diabetic changes. These are all individuals that could benefit from retraining their balance systems.
Mm-hmm. And that's what it fascinates me about what you do. That phrase, retraining your balancing system. What is that? How does that work?
Well, we start with a specialized evaluation. We also use the Tinetti Gait and Balance Assessment as well as the Romberg, which then gears us how the individual scores on those tests, what we need to specifically work on. But the main strategies individuals have to recover balance are an ankle strategy, a hip strategy, and a stepping strategy. And we work within those to retrain the individual on how to overcome an obstacle or a change in their balance.
One of the things, especially when you get to be elderly, is when you lost your balance as a youngster, as a younger person, you had the strength and the mobility and the quickness to catch yourself and keep yourself from falling. Not the case as you get older.
Correct. And strengthening, and being on an exercise program, and we work well with S&T Wellness to keep on a conditioning program. But what it comes back to as well is there's 3 systems: our proprioceptive, sensation in our feet, our inner ear, and our vision. Those 3 systems have to be working together to keep us upright, in addition to overall muscle strength. So we do work a nice conjunction with S&T Wellness, as patients graduate on a continuum to strengthen and condition.
I just want to bring this up now, and then we'll bring it up again. There's going to be a free event, a screening that will be taking place next Friday.
Correct, 9 to 12 at the Human Motion Institute. This is going to be a free balance screening. And we are going to be generating a letter to your family physician that you can take with you with your balance score to open a discussion with your physician if this is something that would be appropriate for you, that, if you need to kind of hone in on some balance skills.
And who do you target with something like that? People who've had a medical emergency in the past, or just general folks who are concerned about their balance?
Both. Individuals that have had falls, individuals that have had joint replacements that maybe just aren't feeling quite steady on their feet, or, as we start moving through the aging process, I'm just not able to do the things as well as I used to do. And these are all individuals that we see.
And you're trying to recover those abilities that you once had.
Yes, working on those.
Let's talk about concussions. And again, we're talking with Jamie Chichy from the Human Motion Institute at the Indiana Regional Medical Center. The Balance and Concussion Center is her area. The Vestibular and Balance Therapy Concussion Management. Concussions in schools right now, and with school sports, we think of football, but it's every sport.
It is.
Students now are required to take a baseline test at the beginning of their sports year. What is that?
So the baseline impact gives us a score so that we know how you are cognitively functioning prior to an injury. So that way we have a comparison when there is an injury. When you take the impact test, the physician can make their clinical judgment based on pre-injury scores, post-injury scores.
So that baseline test is a very, very important role actually on the field of play.
Exactly.
For somebody to get somebody out of a game.
It is a very valuable piece of information to be making clinical decisions on after an injury.
And then how does that play into what you do when that student ends up coming to visit with you?
Well, twofold. They have, their baseline impact from their school. Now, for two of the physicians here in Indiana, both Dr. Bone and Dr. Taylor, prior to seeing these physicians, they do ask patients to schedule with us for a pre-appointment to include a post-injury impact, an ocular evaluation, a vestibular evaluation, and a sway balance test. All of this information helps on your initial visit when you see the physician for their clinical decision making.
Mm-hmm. And so then they come to you,
correct,
having had this baseline test, having had the additional testing.
Mm-hmm.
You then develop a strategy for working with them to foster their recovery?
If they're referred to us after seeing their physician.
Seeing their
correct,
physician, right.
Correct. We will do a pre-workup after an injury for these physicians, and then after the physician determines, their plan of action, it may include further treatment within physical therapy.
Mm-hmm.
And if they do need further treatment, this could be vestibular exercises, ocular exercises, balance retraining.
We hear all the time when we think of pro athletes, Sidney Crosby and his concussion issues and others, somebody can have what's termed a concussion or in the concussion protocol, and the next week they're right back in there on the field of play. Some, they take 6 or even a whole season or however many months to come back. Learning about concussions, that's still going on, isn't it?
It is. I mean, even just what we have been able to incorporate into our program, within the last year. I've been with Indiana Total Therapy and the Balance Center almost 5 years, and what we've progressed within the last 2 to, progress on the balance, including the sway balance testing, and as well as ocular treatment, including convergence and accommodative insufficiencies, which when those are present can prolong headaches, prolonged dizziness, and these are things the physicians are, managing.
Yeah. So somebody who suspects that they or someone that they love has suffered a concussion, what are the things that they should be looking for?
They should be looking for headaches, persistent headaches, dizziness with movement, nausea, light or sound sensitivity would be the big ones there's still mood changes, there's other aspects, but those are, the headache, the nausea, the dizziness.
Mm-hmm. Yeah, and motion must be something that plays a big role in it as well.
It does.
So they react badly to that. And so once you get your hands on them, I would guess that with every patient it's different, because with every concussion it's different.
It is. It is. It comes back to, we develop individualized plan of cares based on our evaluation findings and what we need to specifically target for each patient.
Mm-hmm. Now, at the event next Friday,
yes,
it's going to be September 22nd, and again, it's from 9 a.m. until noon at the Balance and Concussion Center. You go to the Human Motion Institute building, and once you walk in those doors, you just go straight back and to the right to get in, correct?
Actually, as soon as you walk in, we're going to be in the open vestibule
area. Oh, you're
area.
going to be right there.
Yes, you'll see us as soon as you walk in.
Okay.
Yes.
Okay, so what's going to happen at the event? What can people expect?
Well, I will be performing the balance testing and, again, issuing a letter for you to share with your family physician, as well as S&T Wellness will be demonstrating balance exercises for individuals that may have questions or things that they can, safely work on outside of a provider.
Mm-hmm. And this is absolutely free, and you don't need to register.
Correct. You just show up between 9 and noon.
Anybody can walk in.
Yes.
Oh, that's wonderful, because I would guess that there are people who have suffered falls and can't figure out what's going on. Why am I feeling this way? I fell a month ago. That shouldn't have anything to do with it, but it can.
Yes, and it can be a great way for, if you have questions or, you haven't really talked with your physician, stop in. We can see how you perform and if it's something that you need to take to the next step.
Anybody who's at risk of a fall.
Yes, anybody's at risk for a fall.
Terrific. Because we think that, we might not even realize that we've struck our head. Or it doesn't even have to do, you don't have to strike your head on an object in order to suffer a concussion.
Correct. You don't. And especially if you've had previous concussions, subsequent ones sometimes do take less of an impact to have recurrence.
Yeah, we hear about the brain crashing against the side of the skull and some of those things that happen that cause a concussion. We might think it's just a little whiplash or something like that, and it's much more than that.
Correct.
All right. Well, you're doing work that is vital and can really help people to be restored to what they expect of themselves, and sometimes probably can clear up a lot of confusion in people's lives.
Yes. Well, thank you very much. I appreciate the opportunity to get the message out, and the treatments that we have available at the Balance and Concussion Center.
Yeah. How many people work at the Balance and Concussion Center?
3 currently.
3 of you?
There's 3 of
Three
us.
of you. And I would guess that you have your hands full because this is a big issue now.
It is.
Terrific. Thank you so much for coming in.
Thank you.
We appreciate it very much. And again, that screening is next Friday, September 22nd from 9 a.m. to noon. It's at the Balance and Concussion Center. And you don't have to find them. They'll find you. You just walk in the door at the HMI.
That's correct. We will find you.
And Jamie will be right there. Terrific. It's Indiana in the Morning, presented by First Commonwealth Bank. It's WCCS at AM 1160 and FM 101.1. Fox News is up next at the top of the hour. Josh is in the newsroom after that.